Hello everyone, welcome to my discussion on scoliosis part 2. So in the previous video, we discussed scoliosis in the thoracic spine, and in this video I'm discussing the scoliosis in your lumbar spine, your lower back. So generally you do get an S curve. So when one curve starts forming, the other curve forms in the opposite direction to kind of counteract it and to try and get your spine back to center. But little does it know, it's pulling your muscles back into center, but it's giving you the whole perception of looking skew. If only your body knew better, hey? So we are going to be discussing purely only on the left lumbar curve. And as you know in my previous video, if you've got a right lumbar curve, do everything on the opposite side. Okay, so we're going to start off with that stretch over the roller. So you're going to need a roller, or if you don't have your roller or a roller, then just grab onto a few pillows and you can use it for the exact same purpose. So when you've got a curve to the left, it means your spine also rotates to the left. Okay, so my lumbar spine is not only curving inwards to the left, it's now rotating to the left as well, which in turn shifts my hips out of alignment completely. So my left hip's going to go back and my right hip's going to come forward. Now, along with that, because I've got scoliosis in my upper half of my body, my spine then starts to rotate that way. So I get the compressed rib cage. So we're going to try and counteract all of that in the lumbar spine. Okay, so we're just going to take the roller and you place it just into the side, not underneath the rib cage, in your lower rib cage, not in line with the chest. You want it in the lower rib cage where the apex of that curve is. You're just going to roll over, stretch that top leg out, and then reach the top hand overhead. You don't actually need to reach the top hand overhead if it's uncomfortable. We're just focusing on putting pressure into the lower spine. Stay there for me. So I'm going to show you what it looks like from the other way. So looking at my back from behind, you can see that there is a curvature to the left. So watch what happens when I roll and I lie over the roller. I support it, it pushes the spine upwards, and then I take that top leg out and it completely just sets my vertebra into a straight line, getting rid of that hump and allowing those tight muscles to relax and also stretch out. So remember, because it curves to the left, all of these muscles are going to be super, super tight, and all of these muscles are going to be super, super strong. So we need to lengthen it out, but we need to work this side as well. Just going to breathe and relax. Hold it for about 30 seconds or a minute, whatever you feel comfortable with. And then when you're ready, just press yourself all the way back up. So move the roller to the side. Now with that, you need to start stretching into the side. So you're going to come into a nice little seated position, relax the shoulders, and it's going to be left hand onto the mat and the right hand comes up into your side bend. Now you're going to feel super, super tight here. If you were to go the other way, you would probably find that you can fold a lot deeper and a lot more comfortable, because obviously you're going with the longer muscles. Here you're going against the shorter muscles. So you're just going to hold. Again, the arm isn't the important part of it. It's this that's the important part. So if you want to rest your hand on your knee, that's fine. Just feel the pressure of your right knee going down, right side stretching. Taking one more deep breath in. And then gently lifting all the way back up. So now it should feel a little bit stretched. we're going to figure out on how to strengthen those muscles now. So what I want you guys to do is you're going to come onto your hands and your knees. You're going to need a little book for this, or a little bit of a lift, whatever feels comfortable. Now we have to rotate my hips in a way, because remember my hip goes backwards. I've got to try rotate my left hip forward. So in order to do that, if we have on our hands and our knees, we actually need to take the book underneath the right foot. Now it's not doing anything at the moment, but as soon as you lift your knees off the floor, your hips are going to be in a more of a straight position. So you're going to lock the shoulders down, rib cage comes in. And I just want you to exhale and lift the knees slightly off the floor and hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Release. It's always a good idea to do this with somebody watching you so that they can tell whether your hips are out of place or not. You're going to engage the core. We got 2 more sets. So push into the palms, lift the knees, and hold. Got to engage the core. That is your lifesaver here. 7, 6, 5, 4, 3, 2, 1. Release it. You're going to do that 1 more time. Take a deep breath in. And exhale. Lift it up and hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Release it. Now just move the book to underneath the knee. Now you might feel a bit skew in the beginning, but what it's doing again is it's forcing your hip straight. So it's actually forcing my right hip to go upwards and my left hip to go down, which is what I need to rotate my lower left spine back into the correct position. Hands going to stay underneath the shoulders, point your toes, and we're coming into those cat stretches again. So you're going to exhale, scoop, roll the spine up, pressing everything up, and you're going to feel a lovely lengthen into your lower back. And then you're going to exhale, bring it all the way back to neutral spine, lifting the chin up last. Breathe in. Exhale, you're going to engage the core, roll it up, squeeze the bum to the nose. Take a deep breath in. And then exhale, bring it all the way back to neutral. 1 last one. Breathe in. Exhale, curl it up, ribs in, bum to nose. Hold, press into the hands, take a deep breath in. And then gently release it back to neutral spine. Now move the book out the way. You're going to roll over onto your right side only. So remember, your left is a lot stronger or a lot tighter. Not necessarily a lot stronger, but it's a lot tighter. And your right muscles on the right side are a lot more lazy because they don't get used as much. They just get tighter and tighter and tighter. So you're going to move your knees back. And a good way to work this out is to come into a nice little side plank. So you're going to extend your top leg. Top hand goes onto the top hip. Brace the core and you're going to lift up. Now I want you to lift high enough until you feel that those lower obliques are activated. Your elbow has to be in line with your shoulder. Don't drop or hang the head. Lift it up and just hold. Pulling the shoulder away from the ear. Now for the last 10 seconds, give me a few little hip pulses. So you're going to push it up for 10, 9, 8. Feel that crunch. 6, 5, 4, 3, 2, hold. And then gently release it down. 1 more set. Engage your core. Lift it up into your side plank. Reach the top leg out. Hold it for your 10 seconds and then we pulse for 10 seconds. Brace the core. See if you can lift even higher. Now I can feel it's actually pinching so much it's about to cramp. So I'm overworking here. Pulse the hips up for 10, 9, 8, 7, 6, 5, 4, 3, 2, and hold. and then release it and relax it. Well done, guys. We're going to press ourselves up, and the next and last one is just a standing exercise. So now if you have a lumbar curve, obviously your lower left QL is going to be stronger and tighter, so you need to balance it. And what also happens is the hips start swaying to the side. Okay, so we need to strengthen this to pull it back to avoid that look like you've got a little bit of a hump. So you're going to come onto your feet and you're only working the one side. So if it's curving to the left, it means you need to work your right, which means you stand on your right leg. So you're balancing on your right leg, you're going to lift your left leg up, hands on hips, and just hold. This automatically just sets your hips into alignment. It starts working your right QL. You're pulling your tummy in. And it's working your right bum. And you'll find that your left bum cheek will be the stronger bum cheek because everything here is pulling into that spine and holding it. You're leaning everything onto that left side. So we're going to lean everything onto the right side. Now take it to the next level. Your left hand, you're going to bend your right knee and you're going to touch left hand to right foot. And then you're going to come back up to standing. Do it again. You're going to touch and then come back up to standing. Find your balance. Look at one spot. This is not an easy exercise. And you'll probably find that if you swap your legs and you do it on your left leg, your balance is going to be that much better. And just do 5 more. 4. 3. The minute you lose concentration, the wobbles come in. 2. It's completely normal to feel this in your calf and your ankle and your bum. It's working that whole right leg. Last one. Lift it up and hold. Both hands on the hips. Take a deep breath in. And then release it and relax it. Well done, guys. I hope all of this makes sense to you. Please don't be afraid to ask me any questions whatsoever. And I wish you all the best with your scoliosis journey. And I hope you get good treatment for it. And I hope you just don't let it affect you inside. Because I know from a young age, I started letting it affect me from inside. And at the end of the day, it's just a cosmetic thing. But it doesn't take away who you are or what you're physically able to do. So good luck, guys. Take care. Bye.